Okay, so I'm going to be talking about our workforce survey which we did late last year. And I just want to acknowledge that this was a team effort, and we worked very closely with, or AML Alliance worked very closely with the Australian Primary Healthcare Research Institute, and the staff there were Professor Ian Parker, Ginny Sargent, Ian McRae and Nasa Bagari, and we all worked on this together. And also that this survey is funded, or was funded, by the Department of Health and Ageing. So the aims of our survey, and just to put a little bit of context around it, it was done, or a survey was done by AGPN every 2 years. So it started in about 2003, and there was 2005, 7, 9. And so this one was done late 2012 and continued on from those surveys. So we used the same questions, but we also expanded it to ask a broader set of questions. And the aim was to look at the demographic characteristics of nurses working general practice, look at the work and the remuneration that they received, what sort of education and training they had, and importantly what activities they undertook. And the last bit we added in to this survey, it's the first time that these questions had been asked around the job satisfaction of the nurses. And also this was done in conjunction with, or as part of, a broader evaluation by the PNIP. So the Practice Nurse Incentive Program, which commenced in January 2012, is being evaluated by some private consultants, and this survey forms part of the data that they will use to evaluate the PNIP. So what we did is, in previous years, the survey had actually been sent out to individual nurses everywhere. So all nurses were encouraged to fill it in. The response rate was probably not as good as it could be. And recognising that the workforce itself has grown hugely, we felt that it wasn't going to be an appropriate method to actually survey every nurse in every practice, because we weren't ever going to get to all of them. So we decided to use a different methodology, and we got a list of general practices from the AMCO direct mailing house, which is freely, well, it's not free, but it's available for anyone to buy. It doesn't cost all that much. And so we got this survey, got this list of practices from AMCO, and they actually did the sampling for us. So they provided the 20% of practices to us, and they gave us a lot of information. Unfortunately, a lot of the information was inaccurate, and it was very difficult to get a comprehensive, accurate list of practices, who employed a nurse, who didn't, where they were located. Even the addresses were wrong, sometimes the phone numbers, they were duplicated, there were dental practices on it, there was a whole range of information included which we didn't need to know. So it took us quite a while to sort of clean up all that information. We requested that the state-based organisations, because remember we still had the SBOs and the divisions when we started this process, to provide information around those practices and for them to update it as much as they possibly could. We ended up with a database of 1,274 practices after we excluded all the other bits and pieces, and a total of 809, or 64% of these practices, were known to provide the services of at least one general practice nurse. So what we did is we sent out this survey to those practices. So we purposely did not send surveys to practices just willy-nilly. We made sure that they had a nurse, at least one nurse, before we sent out the survey. It was an interesting process really, because when we rang up some of the practices, sometimes the response was, do you employ a nurse? Who's asking? And, you know, do you mind if we send a survey for the nurse? And sometimes the response was, if I choose to give it to her. Thankfully that didn't happen too often, but it actually did happen to me, which is probably the worst person that it should happen to. So we ended up with a sample size of 2,161 nurses that we sent out, and the response rate was 32% this year, or in 2012, which was up quite considerably from both the 2007 and the 2009 surveys. And to get that response rate, we had to send out paper copies, we sent out reminder letters, we sent out second reminder letters, and it took quite a bit to get at least that many surveys back. The green writing is actually the 2012 data, and the black figures are the 2009. So you can see that, you know, the total number of nurses is 10,693. But I think it's interesting to note that New South Wales, which was probably the biggest population state, has got the lowest number of nurses employed in general practice at only 47.3%. And the other interesting thing, I think, is that the numbers had changed over the previous survey of 20%. So it's a continually rapidly growing area of employment for nurses. The registrations, the category of registration for the nurses, you know, 12.6% were enrolled nurses, which is not that different from the survey before. 86% registered, 10.5% registered midwives, and only 0.3% were nurse practitioners. But we had never asked that question before, so this is the first time the survey actually included nurse practitioners. The age structure. No great surprises, I don't think, here. Anyone in the room here under 30? There's a... I was nearly going to offer a prize then. You are in a very special group, young lady. So as you can see, most are in the 50 to 59 age group. Anyone in the room in that age group? Oh, there's a few. And most of them are, is that registered midwife? Few midwives? So there is actually a lot of midwives in that age group. As you notice, in that under 30 group, there's really very few. And there's probably lots of reasons for that. The hours worked, so by sort of a fair bit really, 20 to 29 hours is generally the majority of nurses' work. So all still very part-time. I'm sure none of these statistics will actually surprise you, or most of them won't surprise you. And what we did is we, in order for the PNIP to be assessed and the level of activities that were undertaken, we broke the survey up into several sections, and for the purposes of the survey, we asked nurses whether they did tasks on a daily, weekly, never or infrequent basis. These results have been squashed down a bit. I don't know what the official term for that is, but so we haven't put all the categories in here. They've been sort of collated. But as you can see, in the area of prevention, by far the most common is immunisation. And interestingly, with the PNIP coming into operation and the item number going, it will be interesting to see whether that changes or not. The other factor to consider too is that the immunisation rate are now KPIs for Medicare locals, so although there's no item number for immunisation, it's still important for practices to maintain their immunisation rates. I think the other interesting point here is the delivery of health promotion advice, 81.6%. So that's, I think adds to the evidence that nurses are actually providing a lot of education and are educators. If you have any questions about these, please just interject. So the second group we asked around was coordination. And obviously GP management plans rates pretty highly, referrals to other services rates highly, and liaising with community services and hospitals rates highly. And that probably fits also with Christine Phillips' research around nurses being agents of connectivity. The third one was around clinical tasks. I think what's interesting here is that we focus a lot in our discussions around the nursing role on whether there's an item number for it, and we hear that over and over again. But if you look at what the activities that are undertaken in the practice, is that there isn't actually an item number for a lot of these things. And so assisting with minor surgical procedures, with 86% of nurses participating in that, there's no item number for that at all, and there never has been. There's no item number for triage. So infection control and sterilisation, no item number, etc. So although, we do focus on item numbers, I guess we need to remember that most of what we do in general practice does not involve an item number and never has. So, we do get a bit hung up about it, I think. The other thing too I wanted to point out is the number of nurses that provide student supervision is 11.4%, which is probably higher than what I thought it was. But I think in the next few years and the next 5 years, that's probably going to grow a lot. And if you haven't seen our resource that we've produced called Learning and Teaching in the Workplace, we have plenty at our booth if you want to take one away, because that's going to be a major role for nurses in the future, is about teaching our younger colleagues. Well, hopefully they're younger. The next section was around administration, which is a little bit of a worry that we've even got an administration section in it, really. But do recognise that nurses do provide practice management at some level, and management and other staff. We know that the teams of nurses are getting bigger, the numbers of nurses employed by practices are increasing. I think it's a particular worry that we've got, 19.8 doing work on the front desk and reception. I think that should be absolute zero. Don't know what you think about that. Anyone here do reception work? Yep. Yep. There are several reasons for it, I guess. I think we'd be fast approaching the space where nurses actually need to have their own PA or their own reception staff themselves. And because some of the work that nurses do can be easily off or delegated to an administrative person with a little bit of knowledge and training about what it is they're doing. Stock management, which is a horrible term, I don't like that one. Sounds like herding the cattle, really. But 82%, why are we doing those roles still? Why can't someone else do that? And quality assurance and accreditation, why is it only 62.1%? Why is not that 100%? All nurses should be doing quality assurance, I would think. Remuneration, looked at what nurses were earning. Highest value was $65 an hour. Anyone here earning $65 an hour? I'm not sure, but if I can find out, I'll ask for a job. And lowest value is $15, which is pretty. Studying already completed a university course. When you think that, and this is actual numbers, when you think how many nurses were surveyed, it's probably not really very high. Other post-registration qualifications, nurse immuniser always seems to rate highly, and that's probably been the case for quite a long time now. And I guess it will be really interesting to see whether these change now that the item numbers I think were a great driver for education around immunisation, wound management and pap smears, and now that we don't have those item numbers, we still have the funding, you remember, but whether or not it alters the driver for the education will be interesting. This is my favourite slide, I have to say. I think it's a real shame that we've got 54.2% of nurses only that have the opportunity to use their abilities in the practice. So they're not working till their full scope, which I think is a real shame. 48.9% satisfied with the way the practice is managed, and 50.5% to the attention paid to the suggestions you make. So if we're talking about leadership and how nurses can contribute, it's actually, I can see that there are lots of challenges and barriers around being able to contribute meaningfully to the practice when we've got statistics like these. But this is the first time we've measured this in this survey, so it might actually be much better than what it was. I don't know. So that's it from me. This work was undertaken, as I said, collaboratively, and I have to say the views expressed are not those of the Department of Health and Ageing, obviously, they're mine. We have a printed copy of these, or we did have some on our stand. It's available on our website if you'd like to download it, and if you would like any hard copies sent to the Medicare locals, we can organise that as well. So, thank you. Happy to take any questions.